Welcome back. Well, every Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, palliative care. Good morning, Dr. Brady.
Good morning.
Okay, well, I'm sure a lot of people, myself included, have never heard of palliative care. So can you tell us what exactly that is?
Palliative care is the prevention and relief of symptoms of disease. It's not the treatment of the disease specifically, but it's the care of the patient while they're suffering with the disease.
Okay, interesting. So what kind of efforts are part of good palliative care?
Many. Symptom management is really important. In a patient with cancer, they obviously may have pain, and that pain control is considered palliative care. In addition to that, a lot of patients with end-stage heart disease have congestive heart failure, which means that the fluid in their body backs up in their lungs and it causes trouble breathing. With those patients, palliative care is removing that fluid so that they can breathe relatively normally and comfortably while they have this heart disease that may or may not be treatable.
Okay, so essentially then it's kind of like treating the side effects of some of those diseases.
Absolutely.
Okay. So what are some of the challenges? Because I'm sure there's so many, especially when there's so many different diseases.
There are. Regular communication between the doctors and the healthcare team and the patient and their family is a real challenge, especially in this environment of reimbursement. The goal is to see more patients in less time, but palliative medicine has to be done slowly and with real respect for the patient, listening to the patient, addressing their spiritual concerns, their physical, emotional concerns, developing a care plan which they can use because it's developed for them, by them, which is not the cookie-cutter kind of medicine that we practice for treating the primary underlying serious disease.
Okay. So what are some of the different realms of palliative care? Because I'm assuming there's so many now with all the different diseases, right?
There are, but there are some basic tenets that go across all those serious diseases. Okay. Coordination of care in the sites of care. When a patient who has a serious disease, they may need hospitalization, they may need rehab facilities, they may progress to home care. A palliative medicine specialist will organize the handoffs that occur at each level when they switch sites of care. That's a new description in the last 10 or 20 years in medicine, is handoffs. It makes sure that medications are reconciled so that there's not a confusion about medications, that the patient themselves feels empowered to be a partner in their own care. So handoffs is one of the big ones. Care plans consistent with the values and preferences of the patient is really the ultimate goal.
Right. Okay, wonderful. So that's what palliative care is. So how would you know if you're in need of this? How can you get in contact with someone who can help?
First of all, many primary care physicians, family medicine doctors, and internists are trained in palliative care. Okay. They may not have gone through a formal residency program in palliative care, but they actually know the tenets of palliative care, and so if they don't, they can refer you to somebody who is a specialist. Similarly, specialists are required for taking care of patients that have multiple axes of problems because of their serious illness. So like we talk about, you may need an oncologist, you may need a cardiologist, You may need a nurse practitioner who can help with extension of physician care. You may need clergy involved in taking care of the patient, but the patient always comes first in palliative care.
Awesome, good to know. And that sounds perfect. That sounds like how it should be. All right, well, thanks so much, Dr. Brady, for joining us this morning and
My
breaking down
pleasure.
palliative care for us.